Today, we're going to be talking about the 3 COVID vaccines that are out there right now and being set up for emergency approval. So if there's any content channel, whether it's the Washington Post, New York Times, or just little old us, one thing I think we can all guarantee is there will be errors. When we find them, please fact check us, please point them out. I still have a very active patient caseload. And I was talking with a patient just last week, and I think I told him it was the Oxford vaccine that had been rolled out in the UK, just linking Oxford in the UK. I don't think that was right. We'll cover that today. Now, there are 3 vaccine candidates, Pfizer and BioNTech, Moderna or Moderna, depending on how you pronounce it, how you want to pronounce it, and I've heard both. And the third one is University of Oxford and AstraZeneca. The first 2 are messenger RNA, and the third is a different type. And again, we've got a little bit of detail on this. We will provide more of that detail, again, in writing in the blog when we are able to get that through the process. But let's just talk about that for a minute now. The messenger RNA technology is the first time we've ever done this. We meaning human beings. It's a new mechanism. It's being used for the Pfizer and Moderna vaccines. And scientists will start developing messenger RNA vaccines using the viral genome, which was shared online as a template. You remember when it was still in China, they were able to get the genome out there, put it online. And so from that moment, Pfizer and Moderna were able to start saying, okay, we're going to use that genetic code to make a vaccine. Messenger RNA vaccine also does not require time-consuming steps, such as growing ingredients in chicken eggs. In the old version, you have rooms full of thousands of chicken eggs. Don't have that anymore, at least for this process. Pfizer and Moderna are projected to provide 40 million doses, which is enough for 20 million people. Remember, it's a 2-dose process by the end of this year, just a couple of weeks. The Oxford vaccine uses a harmless cold-causing virus, a virus that causes a cough, to deliver the genetic code for the spike protein. So in all 3 of these, the genetic code for the spike protein is being used, which makes all kinds of sense. If you're going to develop a vaccine to a virus, you want the human body to develop antibodies and T cells and memory cells, other immune cells, to the coding of the virus itself. The coding of the virus for coronavirus is what we call this spike protein. That's the first part that your body will see if you get infected. Some of this came from a Washington Post, great article, what you need to know about the Pfizer, Moderna, and AstraZeneca vaccines. And again, they've got some great images in there. We're going to produce as much of that content as we can in writing on the website. And you can also find it at the Washington Post article that we've referenced. The UK is the first Western country to start mass vaccination. Last week, British regulators authorized the use of Pfizer vaccine. This picture on the right is the first non-clinical trial patient to get the vaccines. We'll show a video of that. In the US, FDA regulators will review the effectiveness, safety, and manufacturing of each vaccine. An FDA advisory committee will vote. The FDA may authorize 1 or more vaccines in mid to late December. CDC advisory committee will then discuss prioritizing the vaccines for high-risk groups. And there's a lot of articles out already which help delineate the sequence of risk, starting with the first responders and the folks that are highly susceptible. What is FDA's emergency approval? The FDA can issue an EUA, emergency use authorization, to quickly get medical products publicly during health emergencies. The FDA has already issued EUAs for coronavirus testing and a few treatments. It's only authorized 1 vaccine ever this way, and that was against anthrax in 2005. How will the vaccines be shipped? The Pfizer vaccine must be kept at -70 degrees centigrade. Unless most of you know this immediately, that's really cold. It's a lot colder than your kitchen refrigerator. These are $50,000 freezers that are required for this kind of storage. Once it's thawed, The undiluted vial can be kept in a refrigerator for only 5 days. A diluted vial can be kept for only 6 hours before it must be discarded. The Moderna vaccine is stored frozen at -20 degrees Celsius, but it can be kept for a month at refrigerator temperatures. This makes it easier to distribute to pharmacies in rural areas without specialized freezers. The Oxford vaccine, you remember, is one of the older methods, not the new messenger RNA. So it can be stored at refrigerator temperatures for up to 6 months. That's an advantage. It makes it far easier to distribute and administer it throughout the world. What percentage of a population has to be vaccinated before herd immunity is reached? That really depends. One of the things that it depends on is how do you define herd immunity? It's estimated to be around 70%, either through a vaccine or natural transmission. So if you look at the graph, you see what happens in terms of active new infections and the number of people that are no longer susceptible because they've already either had the vaccine or had the infection. You get up to about 70%, and the active infection transmission down here in the red begins to drop. But as you see, it still continues. It goes back to that whole concept of R0, the reproducing ability of this virus. As we discussed early on, this virus is very contagious. It's, like measles is very contagious. The more contagious the virus, the higher the amount of herd immunity is required. This images that we used in terms of helping explain herd immunity. Now, are the vaccines safe? That's going to be a big issue. The full safety data have not been made available yet. They are actually in the hands of the FDA committee members, and that will be made public, I think, on the 15th during that meeting. No serious safety concerns have been reported in either trial. Intensive safety monitoring will continue after the vaccines begin to be used. That's called post-market surveillance, safety surveillance. Now, back to that sequence. Who gets it first? Well, it depends on the job, the age, and the health and susceptibility. A framework was devised by an advisory committee at the CDC. Most likely to be first would be healthcare workers working with this disease. I'm a healthcare worker, but I'm staying at home all day, every day, working out of my home. So I'm not going to be one of those first top priority healthcare workers. First responders, residents of long-term care facilities. That's actually one of the areas where I've heard a lot of criticism already, that you don't need it so much for the residents of the long-term care facilities as you need it for the workers at long-term care facilities. I don't really have a comment. I understand the argument about that, but again, let me get back on script before we go down that bunny hole. People with essential jobs, such as teachers and food workers. Our son works at a grocery store. He has continued to work because he's a food worker. Those who are at higher risk due to age are going to be at higher priority than those with underlying conditions. Healthy younger adults who don't have medical conditions or high-risk jobs are likely to be at the end of the line. But still, even though at the end of the line, right now that's estimated to be April or May, according to Tony Fauci. So as you note, and I'll have to say this too, I can't help but making a couple of jabs every now and then. In the beginning of this, Tony Fauci was saying it's going to be 2 years minimum before we get there. Now he's acknowledging we're likely to have this available for the last group in line in about a year, just a little over a year since the disease was discovered. So remarkable. The term warp speed is very applicable here. By June, 100% of Americans that want the vaccine should be able to get it, according to Lieutenant General Paul Ostrowski, Director of Supply, Production, and Distribution for Operation Warp Speed, as he told to CNN. Children may get last access. Pfizer's the first and only company to expand its trial to people 12 years old and under. Here's a couple of questions. Once the shot is given, is the person immediately protected? This is a 2-dose vaccine process. It takes around 2 weeks for vaccine to kick in. Pfizer's booster shot will be given 3 weeks after the first one. Moderna's or Moderna's second dose is given 4 weeks afterwards. The Oxford vaccine also requires 2 doses. The trial found it was far more effective when the first dose was half the typical dose and the second was given a month later. As you know, most people know, that's not uncommon for a lot of vaccines. And typically what you'll see with other vaccines is 60 to 80% uptake after the first, and then much better uptake after the second dose. Do not take that to the bank. That's got nothing to do with these. There's no data about these available at this point. Just remember, these are all 2-dose vaccines. And I'm sure that information will come out as you start getting into a mass vaccination program. There are going to be a lot of cases which come up where people only got 1 dose, and we begin to understand a little bit more of the efficacy at that level. It's a 2-dose vaccine. Should a previously infected person need to be vaccinated? This did not exclude people who are already infected. Until the CDC committee evaluates the full data, the agency won't make recommendations on this matter. Again, I can't help but go off script on some of these things. My guess is that they are probably going to recommend that even people that have had it get this vaccine. And the reason is, there's a lot of evidence that the vaccines are better at creating longer-term immunity than the infection itself. They don't create as much of the immune storm where the immune system is tripping over itself. So there's a lot of reason to suspect that they're going to say that. Again, that's not policy yet. That's my digression and my personal opinion. Will people still need to socially distance? Yes, the vaccines are promising, but they're not a silver bullet. They're not an excuse for people to let their guard down. The vaccine doses are still limited, and it'll take time to get enough vaccine doses out there to create the levels of herd immunity that we'd like to see. Will people have a choice on which vaccine to take? You hear a lot of that conversation, or at least you heard a lot of that a few weeks ago. But once you begin to see what's going on, you begin to realize, you know what? Supplies are going to be very short initially. You're not going to have 3 options. You're probably going to have 1 option for a while. The vaccines have different storage and handling requirements, so most places are going to have probably 1 vaccine on hand. How will a person know which vaccine will be best for him or her? That's starting to get a little bit beyond where the evidence would take us right now. The FDA will first authorize each vaccine based on safety and efficacy. The CDC advisory committee will then subsequently make recommendations like whether 1 vaccine may be preferable for a certain group. What will happen if you don't get vaccinated? Well, if you don't get vaccinated, other vaccines that are being worked on, in fact, less than a year ago, there were over 100 vaccines that were in some stage of development. I don't think we're going to end up with 100 and something vaccines, probably, maybe half a dozen or so. In most vaccine markets, you end up with more than 1 vaccine available. And I suspect that will happen here as well. Later generation vaccines, like I said, are in development. Continue to get great feedback regarding the webinars. And here's why. On the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CIMT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.